Prostatitis is the most common urologic condition in men under 50, and the third most common in men over 50. In fact, about 5% of men between the ages of 20 and 50 either have prostatitis or have experienced it at some point. And nearly 2 million visits happen every year in the United States because of prostatitis. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to go over everything you need to know about prostatitis. We'll discuss the symptoms, the different types of prostatitis, how it's diagnosed, and the treatment options. So if you find this helpful, be sure to subscribe and share this channel with your friends. So what are the symptoms? Well, the most common symptom is pain. And where can that pain show up? It can be in the lower abdomen, in the penis, in the testicles, in the perineum, which is the area between the scrotum and the anus, or even during urination. Sometimes, if you have what's called acute prostatitis, it can come along with other symptoms like fever, nausea, or vomiting. So it can be quite uncomfortable and, in some cases, a serious condition. Now, it can be a bit complex because there are different types of prostatitis. So when someone tells me they have prostatitis, I need to determine the cause. Is it due to a bacterial infection, inflammation, or something else? First, we divide it into two main groups, whether there is evidence of a bacterial infection or not, and that infection can be either acute or chronic. If you have acute bacterial prostatitis, you can feel very unwell. You may have a high fever, chills, nausea, vomiting, and sometimes trouble emptying your bladder. Along with that, you may have difficulty urinating and occasionally pain during urination. Some people also feel a strong, frequent urge to go, like they constantly need to rush to the bathroom and can't hold it for long. The other type is chronic bacterial prostatitis. In this case, symptoms can last for a long time, but you may not feel as sick. You usually won't have fever, chills, nausea, or vomiting, but you may still experience many of the other symptoms I mentioned. Sometimes, this develops after an acute episode, where you were very sick, got treated, but the symptoms never fully went away. It can also be linked to conditions like diabetes, a recent urinary procedure or surgery, problems with fully emptying the bladder, or even having a larger than normal prostate, all of which can increase the risk of chronic bacterial prostatitis. So why do some people develop chronic infections? It's because bacteria can settle inside the prostate, which is a place that's very hard for antibiotics to reach, and also difficult for the immune system to fully clear. The other category of prostatitis, the second half, is non-bacterial prostatitis. This can be long-lasting and may be due to inflammation or even a non-inflammatory cause, but the symptoms can look very similar. If you fall into this non-bacterial group and have had symptoms for at least 3 out of the past 6 months, and infections have been ruled out, you may have what's known as chronic pelvic pain syndrome. This includes many of the same symptoms I talked about earlier, and sometimes also issues with sexual function, such as premature ejaculation or erectile dysfunction. Although it's often labelled as prostatitis, it's not always clear if the prostate is truly the cause or if other factors are involved. So what actually causes prostatitis? In many cases, it's due to a bacterial infection. One common reason is something called intraprostatic ductal reflux. In simple terms, instead of urine flowing out normally through the urethra, some of it flows backward into the prostate. This backward flow can carry bacteria into the prostate and lead to the kind of bacterial prostatitis we discussed earlier. Certain factors can increase the risk of this happening. As mentioned before, prior procedures involving the urethra can play a role. Having foreskin that does not retract properly can trap urine and create higher pressure. Unprotected anal intercourse may also raise the risk. Using a catheter, including a condom catheter, can increase the chances of this reflux as well. In addition, problems with bladder function can contribute. For example, an enlarged prostate can make it harder to empty the bladder, leading to straining and higher pressure. Certain neurologic conditions can also affect how the bladder works, increasing pressure and making it easier for urine to flow back into the prostate. All of these situations can raise the risk of prostatitis. Other possible causes include issues with the immune system and problems with the pelvic floor muscles. I've talked about this often. When the pelvic floor muscles are too tight, it can make it harder to empty the bladder, and can lead to ongoing pain. Psychological factors can also play a role in some cases. Another important factor, as I've mentioned before, is medical procedures or surgeries in that area. One example is a prostate biopsy. In a small number of patients, this can lead to prostatitis and, in some cases, make people very sick. That's why it's so important to take antibiotics before having a prostate biopsy. So what happens when you visit the doctor? First, we're going to ask you quite a few questions. Where exactly is the pain? When does it occur? How long has it been going on? Have you ever had any sexually transmitted infections? What is your usual urination pattern like? How often do you go? Do you feel a frequent urge or have to rush to the bathroom? Do you wake up at night to urinate? Do you ever feel like you have to wait for your bladder to fully empty? Does your stream stop and start? Is it weak? Or do you sometimes feel like your bladder isn't emptying completely? And of course, we'll also ask if you've had any recent medical procedures. One condition that isn't very common in the United States, but may be seen in other parts of the world, is tuberculosis, which can also infect the prostate and cause similar symptoms. After reviewing your history, we'll perform a physical exam, which usually includes a digital rectal exam. However, if you are very sick with fever and chills, and we strongly suspect acute bacterial prostatitis, we may skip this step or perform it very gently. That's because firm pressure or massage of the prostate in this situation can push bacteria into the bloodstream and make you even more ill. We'll also run a urinalysis and a urine culture. In some cases, we may measure post-void residual urine using a bladder ultrasound to see how well you are emptying your bladder. If you're experiencing testicular pain, we might order a scrotal ultrasound to rule out any masses or abnormalities in the testicles. Depending on your symptoms, such as significant abdominal or back pain, we may also request imaging of the abdomen or even an MRI of the spine. So how is prostatitis diagnosed? Most of the time, it's based on urinalysis and urine culture. But how do we specifically check urine from the prostate? In a clinic setting, many urologists perform what's called a two-glass test. This means you first provide a urine sample as you normally would. Then, after a gentle prostate massage, we collect a second urine sample. Comparing these samples helps us determine whether there are bacteria, white blood cells, or signs of inflammation coming specifically from the prostate rather than the bladder. So now let's talk about how we treat it. For acute bacterial prostatitis, the main approach is antibiotics. If you're hospitalized, you'll usually receive intravenous antibiotics. If you're being treated as an outpatient and your symptoms are not severe, oral antibiotics are typically used. These are often chosen based on your urine culture results. A urine culture helps us identify the exact bacteria causing the infection and which antibiotics will work best against it. Unlike a simple bladder or urinary tract infection, prostate infections usually need a longer treatment course, typically 4 to 6 weeks, to make sure the medication fully reaches and treats the prostate. In the same way, chronic bacterial prostatitis is also treated with a longer course of antibiotics. However, if you don't get better and your urine culture is negative, continuing antibiotics is unlikely to help. At that point, we start considering other causes, including non-bacterial prostatitis. One of the first treatments often used in these cases is alpha blocker medication. Common examples include tamsulosin or alfuzosin. These medications work by relaxing the prostate and the bladder neck, which helps reduce the high-pressure urination we talked about earlier and may ease symptoms. We may also use a short course of anti-inflammatory medications, especially non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. In some cases, steroids or other immune-suppressing medications may be used, although this is less common. There is also some evidence that 5-alpha reductase inhibitors can help. These medications reduce the conversion of testosterone into dihydrotestosterone, DHT, inside the prostate, which can lead to a reduction in prostate size. Another possible cause of symptoms is high-tone pelvic floor dysfunction. For these patients, pelvic floor physical therapy, working with a trained therapist to learn how to relax these muscles, can be very helpful. Now, what about prostate massage? Many people ask about this. In the past, it was actually a common treatment for prostatitis. Patients would visit their urologist several times a week for prostate massage sessions. The idea was that massaging the prostate could help drain blocked ducts, improve antibiotic penetration, and increase blood flow. Early studies suggested it might help, but more recent research has not shown clear benefits. Because of that, this is no longer a standard treatment. There are also other therapies that have limited evidence and are not widely used. One example is posterior tibial nerve stimulation, a treatment more commonly used for overactive bladder. It involves placing a small needle near the ankle to stimulate a nerve that connects to the bladder. Other approaches that have been explored include acupuncture, as well as extracorporeal shockwave therapy, which has also been studied for erectile dysfunction and may provide mild relief when applied to the perineum in chronic prostatitis cases. Lastly, some medications like tricyclic antidepressants, such as nortriptyline or amitriptyline, have shown some benefit. Certain supplements, including bioflavonoids and pollen extracts, have also been studied in small trials. Overall, this can be a difficult condition that causes significant discomfort and stress for many people. I hope this video helped you better understand it. If it did, be sure to share it and leave a comment below to let me know your thoughts. And as always, remember to take care of yourself, because you're worth it.